loves Limelight with Masuma. I know by our survey and your complimentary emails that you as a viewer always look forward to this segment. I do too. The hostess herself is vibrant and beautiful. She's known to be charismatic and charming. Her good name is Mrs. Masuma Papia. Masuma ji is a makeover artist. No wonder women love her. Masuma ji is also our chief makeup artist here at the studios of GTV. Anyway, back to her screenshot, whereby she has alongside her a rather interesting guest. Let's step forth and meet both these personalities.
Hello everyone, good morning and welcome to Limelight with Masuma. I'm your hostess, Masuma Papia. Limelight with Masuma is a TV show focused on promoting and highlighting business owners, professionals, upcoming trends, and key social issues. Above all, it's a show about people from different walks of life sharing their experience, their passion, views, and expertise with us. Every time a woman is faced with feelings of self-doubt, it's important to have a strong role model they can look up to. Someone who can inspire them to become a strong individual and teach them to approach life with confidence. I read it somewhere, when you drop your excuses, you discover that you can choose to pursue your dreams or not. You can live life fully or you can live it small. Living life fully takes courage, and courage is a choice, and the choice is yours to make. So for today's episode, I am super excited to have such a courageous role model as a guest. She's beautiful, she's successful, super hardworking, and has a great sense of humor. And like that was not enough, she's a very successful doctor and a model on the red carpet. So let's welcome to the show, Farah Fourcand. Farah, thank you so much for coming to our show today. Really appreciate it.
And thank you for inviting me.
So Farah, I know you well. But for our viewers, tell us a little bit about yourself, your background, where you're from, things like that.
I was born and raised in Miami, Florida.
Okay.
I'm a first-generation American. I finished up high school and then I went to college at University of Miami.
Okay.
I studied biology and chemistry. I also minored in anthropology, art history, and philosophy.
Oh my goodness, that's a whole lot of stuff.
And then after that, I got accepted to medical school in Miami as well. I went to FIU Herbert Wertheim College of Medicine.
Okay.
I finished up in 2015.
Okay.
And then I did want to venture out. I lived in Miami my whole life, and I wanted to try something a little bit different.
I was wondering, why would you ever want to leave Miami? Like, it's so gorgeous down there.
It's good.
But if you lived there all your life, I guess you want to get out.
Yeah. So one of the places I'd always wanted to live was DC.
Okay.
So I applied for residency up here, and I got accepted to Georgetown, and I'm in the clinician scientist residency program, which is a collaboration between Georgetown and the National Institutes of Health and the NINDS.
Okay, so you came here for residency. What do you specialize in again? I know you've talked briefly about that, but what's your actual specialty? Like, what's that area?
I'm a neurology resident, so I'm trained in diseases of the brain and spinal cord and overall nervous system. And my particular interests are in research as well, with neurostimulation and its applications towards other sort of neuropsychiatric diseases.
Wow, okay. Well, I can't wait to talk about all of that. So what, when I introduced you, I've mentioned that you're a model and a doctor. What made you choose such, interesting career? And they're completely different, obviously. But what made you go into both of these careers? I mean, obviously, you're a very successful model because I've worked with her as a makeup artist, so I know she's successful. So what made you, what intrigued that? Like,
well, I mean, growing up, I wanted to be a doctor since I was a little girl. And my family and friends had always kind of encouraged me to go into modeling, but but I wanted to focus on one thing at a time. And medicine is something that requires a lot of dedication, a lot of time, a lot of effort, and a lot of focus. So I decided to kind of pursue that primarily. And then once I settled into residency and I realized that it is manageable to a point, and it is manageable.
Is it?
Yes.
I know your long hours, but we'll talk about that.
It's manageable. I decided that it was an opportune time to go into modeling, and I'm glad that I'm doing both. And I mean, it's kind of nice because as a doctor, I kind of, with my fellow like co-doctors and residents, I can kind of
relate in a way.
Yeah, I can kind of show like that you can have a life outside of medicine, and that it's possible to balance work and life, because in residency especially, that's something that's very kind of difficult to do.
Sure, yeah.
And then with modeling, it's also very interesting because a lot of the models are like, it's so cool that you're a doctor too, because a lot of them do modeling first, and then they have these kind of pursuits when they're older about doing other things.
But you know, being as a makeup artist, and I didn't know this before, you know, I started meeting some of these models, and I noticed how like it's a lot of dedication goes into it. Like it's not just, oh, I'm done with my walk and that's it. It's actually a lot of discipline, almost like I'm sure being a doctor. So it's not that easy as it sounds, but you do such a good job. Thank you. So you talked briefly about going into modeling, but do you like it? Like, is it something that you want to continue doing, or go solo being a doctor?
I want to do both.
You want to do both for now? Okay.
With medicine, it's something that it's always going to be my priority. It's always going to take kind of the forefront.
Sure.
And it is demanding, but nonetheless, in my free time, I want to devote it to going into like being as successful as it possibly can in the modeling industry.
Well, you're very successful. I know it. So this is something that, you know, I always wanted to know about doctors, because my exposure to doctors are like Grey's Anatomy, and I believe all of that to be true. So maybe you can tell me otherwise. So what's your average day like? I mean, I know talking to you via text, I know how busy you are. When you say, oh, busy, I'm pulling 30 hours, but I want to hear from you.
Well, it varies.
Yes.
But it's kind of a good time to talk about it, because this past week has been the busiest ever. So within like the Georgetown Neurology program, I'm the resident on the ward service, meaning this past week I'm not on the stroke service. I pretty much deal with everything but stroke this week. So from multiple sclerosis to Guillain-Barré syndrome, whatever is not stroke, right? And usually a busy service is like 15 patients.
Oh my
but
goodness.
This week I had 30 patients, and that's like a record for our program. Like nobody has ever had to manage 30 patients as kind of independently doing that.
Oh my goodness.
And I, every day this week, woke up at like 4 a.m., went to work, saw all my 30 patients before 7 o'clock, and then we have our educational rounds, then we round with our attending physician. And when we have 30 patients takes a while, because especially when you want to be thorough and people have like complicated neurological diseases, it takes time, because you want to make sure you don't overlook even little things, because everybody wants to be number one and everybody wants to be taken care of.
Yeah, and I'm sure you have to answer questions too,
and
when you're
pages, and we have like all these pages and and writing notes on everybody and seeing everybody and treating everybody. And I would get home like at 9 or 10 at night. And honestly, I have to say that it taught me like that I really am doing what I should be doing with my life, because
so you enjoy it.
I actually, in a masochistic sort of way, enjoyed it tremendously, and I maintained my patience, maintained my empathy, and didn't complain, and just kind of like pushed through it and actually enjoyed it.
Yeah.
And it was a crazy week.
Yeah.
And I do it again next week.
And I thought doing 8 models makeup all at the same time was hectic. Apparently not. She tops it with 30 patients. So, but you know, one thing you and I talked about, and I actually saw it, that you're very passionate about helping people. So being able to do that, I mean, I'm sure that brings certain kind of satisfaction.
I mean, I love it. Yeah. Like, honestly, like sometimes people go into certain professions maybe for not the best of reasons, but if you go into something for the right reasons, because you truly love it, then you kind of you enjoy it no matter how intense it really gets,
Yeah.
and it helps you to kind of
Be a better person.
to remain satisfied and happy with yourself, and then
Sure.
you exude that to everybody you're taking care of, and they
Yes.
see that you actually genuinely care about them, and you actually genuinely want to help
and you
them.
do it. I mean, look at you. You're gorgeous. So you're pulling 30 hours and looking like this. Hey, I think everybody should go into a medical field. So I want to talk about something very interesting, because we briefly, when we talked earlier, we briefly talked about your research. You have a very interesting topic. Can you tell us a little bit about your research? What are you working on?
So with my program specifically, so I'm a resident at Georgetown, but when I applied for residency initially, the program was starting this collaboration with the NIH.
Okay.
And they accept one resident per year for that program, and I was the first one to be chosen for that.
Wow.
So it's with the specific neurological branch of the NIH is the NINDS.
Oh my goodness.
And my research interest is specifically with neurostimulation techniques, which is things like TMS, which stands for transmagnetic stimulation of the brain.
Okay.
It's not invasive.
Okay.
And I'm interested, like the applications for that and other sort of neurostimulation techniques like DBS, which is deep brain stimulation, which is used for Parkinson's disease, is my particular interest is more for the neuropsychiatric components.
So is it like a cure that you're looking for, or like trying to find out more about the particular,
Kind of all of that.
Okay.
So with the TMS, my particular interest is in addiction.
Okay.
And neuropsychiatric diseases like schizophrenia.
Sure.
And also in sort of neurodegenerative diseases like Alzheimer's and Parkinson's and other forms of dementia. So with the TMS procedures, we target particular parts of the brain that are affected by these ailments, and through the TMS sort of like device can kind of like modify different neurotransmitters and kind of like just change kind of the chemistry of the brain to lessen somebody's addiction to a drug or to a particular behavioral issue. With something like schizophrenia, we can target parts of the brain that are seen to be overactive in people who have like psychosis and whatnot, and et cetera. And even with normal people, you can kind of optimize learning and cognitive function with TMS. So that's my ultimate goal.
It's interesting. I mean, not just culturally, I should say, in general too, I've seen a lot of time, people with schizophrenia or even any kind of mental problems, we tend to hide it or it's almost like, you're ashamed of it. But this is something we really should talk about.
Exactly.
And bring more awareness to this subject. I'm glad you're working on something as sensitive as that, because there are a lot of people out there, like I know a friend of mine who's suffering from, and she does not want to take any medications because somehow she thinks she'll be labeled as a mental patient, which is not the case. It's so thank you. That's let me know how it goes. I would be very interested in finding out. Wow. So you've done so much at such an early age. Do you feel yourself to be, or pioneer to be, a new kind of role model for women? I know more and more women need to look up to someone like you, but what do you want to tell our viewers or young girls out there who are kind of hesitating as what they want to be, or what career path they want to go to? What is your advice?
Well, I feel that a lot of role models these days are not maybe the most ideal. Sometimes I feel like it's important to embrace intelligence, and it's important to embrace selflessness, humanitarianism, and kind of wanting to contribute to something greater than yourself. And I feel like within the modeling industry and like kind of fashion and media, that's where young people look to for kind of a role model. Like, you can be a doctor, you can be a scientist, you can be brilliant, but oftentimes somebody behind a lab bench or in a white coat is not as looked up to as somebody on a magazine or somebody walking down a runway.
That's so true.
So
that's more glamorous.
Exactly. So one reason I wanted to pursue this was because I felt like I have a lot of kind of maybe altruistic goals and but I feel like that would be better taken in this sort of in modeling or in some sort of like industry outside of medicine.
Okay.
And I feel like young women or young people, not women, just young people or people in general, you know, should kind of try to be something a little bit more and aspire to be something a little bit more. And I feel like there are some strides in modeling and in fashion with, you know, accepting women who are different sizes, different races, different, like, who are diverse and all of that. But nonetheless, at par with being different cultures, different sizes, it's important also to embrace the inner parts, the inner side, like intelligence, embracing work ethic, and wanting to just contribute something to the world, more so than
such a good advice.
Than otherwise.
Thank you. That's such a good advice, and it's true, because I think young people in this generation have, and you talk about modeling industry, it's not all that easy to actually be a model and walk the red carpet. There's so much more to it, and you tend to sometimes, you know, get a little I don't know, diverted. So that's a very good advice. So Farah, where do you see yourself in the next 20 years?
20 years.
Well,
I'm kind of open-minded, and I kind of think life will take me where it takes me.
Okay.
But I do have kind of these set goals that are, you know, that I can adapt to whatever happens in the future. My ultimate goal would be to do a lot of research in the areas of addiction, neuropsychiatric disease, and neurodegenerative disease. And then after that, kind of pioneer maybe outreach for individuals afflicted by those sort of illnesses. I'd also like kind of to make that more applicable and relatable to young people. You know, I have to figure all of that out.
Well, I wish we had more time to talk about, you know, or talk to you, I should say. But good luck with everything that you're doing and sharing your story. This brings us to the end of this episode. I hope you like this segment. If you enjoyed this episode and would want to see more related topics like this, or want to be on the show as a guest, please email me at limelightwithmasuma@gmail.com. or call me at 703-646-0098. So until we meet again, stay happy, stay healthy, and enjoy life. Thank you.
tak tak tak